Hey, this is Dr. Matt Joosse at Joosse Family Orthodontics. This is a great educational video because you're going to learn a lot about how we deal with impacted teeth, some new advancements to treat impacted teeth. You're also going to see how treating impacted teeth can really make a difference for somebody aesthetically as well. So Ella came to us looking for a nicer smile. She also wanted to close the spaces between her front teeth. So here's a close-up of Ella's teeth when we first met her. Obviously, your eyes are drawn to the large gap between the front two teeth, spaces between the next two teeth, and large spaces behind those. Now, the large spaces behind those are where the canine teeth belong. And what Ella didn't realize is that those canine teeth were not coming in properly. They were stuck up underneath the gums. They were impacted. Here's a picture of where those canine teeth were. And just to give you some orientation, these are the teeth that we're talking about. They are not pointed down into the mouth. They are pointed towards the middle. And when these teeth lose their way, they often will erupt towards the middle of the mouth. And in worst case situations, they can actually start to do damage to the roots of the adjacent teeth. And so I have seen cases in my career, only once or twice, where these teeth have done so much damage that it renders some of these upper front teeth hopeless, and those teeth actually need to be extracted. So that's what you really want to try to avoid. This is one reason why it's really important to go see your orthodontist before you have all your adult teeth in, because sometimes you might be waiting and waiting and waiting for these adult teeth to come in, and they never are going to come in because they're stuck underneath the gums and they're potentially doing damage to the adjacent teeth. So great idea to have an orthodontic consultation at age 7 or 8. Great idea to have an orthodontist be watching the eruption of the teeth as you progress. I think we started seeing Ella when she was about 10. Okay, so these canine teeth are not erupting the way that they should be. They should be coming into these spaces right here. So what do we do about that? Well, we put braces on first. We push the front teeth together. We consolidate space where those canine teeth belong, and then we go rescue those canine teeth. Historically, we've sent situations like this to an oral surgeon, and they do what's called an expose and bond procedure. They'll bond a gold chain to the canines, and we'll use that gold chain to kind of link by link pull the teeth into the mouth. Now, we still sent Ella to an oral surgeon. She still had the expose and bond procedure where the oral surgeon finds these teeth and bonds something to them. But in this case, there's been a new technology. This is called an Isoglide eruption spring. So it's a spring that gets bonded onto the canine teeth. And instead of Ella having to come into our office once a month and get the gold chain, the way we pull that gold chain down is with an elastic thread. To have that elastic thread be reactivated every single month, it's a lot of appointments. This is called the Isoglide eruption spring, and you can see it almost looks like a slinky attached to the teeth, and it's bringing the teeth down. We did not need to see Ella every month for this. We saw her every 2 months, maybe every 3 months, as we waited for these canine teeth to erupt down into the spaces where they belong. So you can see that we've kind of pushed the forefront teeth together. I actually still had some space that we could have closed right there. We created space for these teeth to come in. We sent her to the oral surgeon for the expose and bond procedure. They bonded the Isoglide eruption spring, and the canine teeth came down into the mouth. Here they are fully down into the mouth. We were also waiting on a few other adult teeth to come in fully. So we eventually did that. And just one thing I wanted to point out as we get to, this is our finished x-ray. But if you notice the root of that one adjacent tooth right here, I believe that we might have had a little bit of damage to this root as that canine tooth was kind of erupting into it. And as we tried to rescue it, there might be just a little bit of that root missing now. That's something that we call root resorption. Root resorption is something that can happen with orthodontic treatment. It's especially prominent when you are rescuing impacted teeth. And in situations like this is a minor amount of root resorption. It is not going to affect Ella in any adverse way in her future. Just something that we need to note, and something that we'll let the family know about, of course. So what happened in the course of treatment? Well, here are our upper teeth at the end of treatment. And so braces off, you can see that the canines are fully in the mouth. We bonded a little wire between the two front teeth to help ensure that that gap between the two front teeth doesn't come back. And here's a view of Ella's teeth from the front. Quite a change if you remember from where we started. And here's Ella's smile at the finish. And this is, of course, my favorite part. When you bring in impacted teeth, it makes such a difference in terms of how somebody perceives her smile. And when Ella first saw herself in the mirror, she was almost in tears at how beautiful her smile was. And if you can think back to where Ella started, this is just an incredible change. And so the functional difference it makes to bring somebody's impacted canines in is huge. Canines are really important teeth for the bite. The aesthetic change is even better. And in this case with Ella, this is just a home run. So happy for this girl. She was an amazing patient throughout treatment. And we're really blessed to be able to change lives like Ella's through orthodontic treatment. So hope you learned something today about impacted teeth, why it's important to go to an orthodontist at age 7 and 8 to check and make sure that teeth are not becoming impacted. Hope you learned something about how we rescue impacted teeth and that new technology of the Isoglide eruption spring. And hopefully learn something about what we're able to do aesthetically in these cases as well. Thanks for listening.